So what do we know about why that trend is occurring? Sharyn Parks Brown is an epidemiologist at the CDC. Commander Parks Brown, thank you so much for being here. Again, similar question to you. We had been making, it seems, progress on saving the lives of more young people and keeping them alive after they were born. But then there was this sudden turn during the pandemic. Did that spike that we saw come as a surprise to you?
Yes, this was absolutely a surprise for us. So we were looking to compare the rates of sudden unexpected infant death prior to the COVID-19 pandemic to the first year of data after the COVID-19 pandemic began. And as you outlined, we did see that the overall SUID rate between 2015 and 2020 did not change, but we did see that surprising increase in the SUID rate among non-Hispanic Black infants.
May I
The
just interject for a
other,
second? The SUID rate, this is
yes,
the sudden unexplained infant death. That's what you're referring to?
sudden unexpected
Unexpected,
infant
yes.
death.
I'm
Yes,
sorry. Continue,
yes.
please.
Yeah, so along with us being surprised that the rate increased so starkly for non Hispanic Black infants, it's important to point out that the racial disparities and the pattern of those disparities had been consistent from as far back as 1995, where we typically saw the highest rate of sudden unexpected infant deaths among American Indian, Alaskan Native infants. But in 2020, that flipped so that non Hispanic Black infants actually had the highest rate of sudden unexpected infant death, then followed by American Indian Alaska Native infants.
So again, do you have a sense as to why this sudden spike occurred?
Similar to what my colleague stated about maternal mortality, we don't have data at this point to really explain why we observed this spike in infant mortality. But again, we also believe that there were some indirect effects of the COVID-19 pandemic. So we know that a lot of the mitigation efforts disproportionately affected racial and ethnic minority communities compared to not Hispanic white families. So things like exacerbation of housing insecurity, food insecurity, unemployment, changes in healthcare access, all of those things could have impacted, for instance, access to childcare, so that families had people who were not typically caring for their babies now were responsible for taking care of those infants. We also saw changes related to housing instability. Families may have been exposed to sleeping arrangements that they weren't used to. So, where they normally may have had access to a safe sleeping environment, like a crib for their infant, maybe due to sudden unemployment associated with the pandemic, they were without their safe sleep arrangement and may thereby have been putting their children in riskier sleep environments.
So that is one of the possible factors here, that children in a might be suffocation or something that we've thought of in the past as complicit in children suddenly dying.
Yeah, so we could be talking about infants that are suffocating in their sleep environments, but some of these babies also, we don't have evidence that they've died of suffocation, but some of them just may die for other unexplained sudden reasons that they're more at risk for as a result of being in unsafe sleeping environments.
And again, to this point about the specificity of how this seemed to be particularly amongst Black infants, as opposed to other lower socioeconomic or racial minorities in America, how do you explain that particular trend?
Well, that's something that, again, this is 1 year of data. And so we're going to continue monitoring to see if this spike that we observed in 2020 is, just a artifact in the data or if it's something that is actually sustained. And also try to use some of our other data sources like our sudden unexpected infant death case registry at CDC that has a lot of rich data on social determinants of health to try to really tease out what the factors were that could have been driving the increases that we observed. So that's a question that we will be continuing to monitor and do surveillance and research on.
All right, Sharyn Parks Brown and Shauna Cox, thank you both so much for being here.
Thanks for having us.